We want to give you an update now on the two American Ebola patients. CNN has just learned the specially equipped plane to pick up the second Ebola patient has just departed from Georgia en route to Liberia. Nancy Wright-Bowl is due to arrive back in the U.S. sometime on Tuesday, and she will also be taken to Emory University Hospital in Atlanta for treatment. We want to bring in Dr. Sherry Fink now. Dr. Fink, to my knowledge, it's the first time an Ebola patient has been in the U.S. Are there ethical concerns with moving an infected patient into the country from so far away?
Well, I think certainly we were all surprised by this. Some people were shocked. I've heard people saying, oh, that's so selfish of them. But obviously, our public health officials here felt that any sort of concerns were outweighed by the benefits of, having these Americans have the right to come back home for treatment. And I think they thought that the risks were very, very small given the expertise of the facilities here. And I think when it comes to ethics, there are even some benefits that we might get from this. I've worked in a lot of emergencies, and I think that we want our public health officials here, we want our medical officials to be able to, treat things at a time when we might have an outbreak of who knows what. So even that practice that they're going to get from this could be very helpful.
And something that's so important to know, over 700 deaths so far in just those 3 West African nations, could go much higher. WHO saying it's going to take months to contain this. There is no cure. There is no vaccine. There is no treatment at this point in time. When you look at the R&D dollars it takes to get there, look, a lot of folks would say it is not profitable, so we may not see this come from big pharmaceutical companies. They're working on it. What is that? What do we know about that in terms of a treatment coming?
Yeah, so we need, it's exactly as you said, when there are these far off diseases that affect a few people, maybe we're not investing enough in it. And so there is research going on, but we need more. And this shows us, this demonstrates we are all human, the world is connected, and we do need money, research going into this, and we need just the very basic health infrastructure in these countries. I mean, I just talked to a doctor who came back from treating Ebola, and he said that there wasn't even running water at some of the facilities. So we need to pump that up so that we, stop those outbreaks before they even spread.
Yeah, it gives you the sense of the devastation. Appreciate the expertise all evening for us. Thank you so much, Dr. Sherry Fink.